Greetings. Welcome to the Acute Gastroenteritis online session. I am Dr. Kasubha. The objectives of this session is to correctly diagnose a child with signs and symptoms of acute gastroenteritis, to properly manage a child with AGE, and properly refer a child with AGE to the resident or consultant. Acute gastroenteritis or AGE is the infection of the gastrointestinal tract. It can be caused by viral, bacterial, or parasitic pathogens. It can be foodborne or waterborne. Usual presenting symptoms are diarrhea and vomiting, as well as abdominal pain and fever. It is transmitted by the fecal-oral route. Diarrhea is best described as excessive loss of fluid and electrolyte in the stool. The normal value of stools is 5 ml per kilogram per day for infants and 200 grams in 24 hours for adults. There is passage of unusually loose watery stools at least 3 times in 24 hours. The clinical types of AGE are acute watery diarrhea, including cholera, acute bloody diarrhea or dysentery, the persistent diarrhea, and diarrhea with severe malnutrition. Acute watery diarrhea lasts for several hours to days, and the main danger is dehydration. While acute bloody diarrhea, the main danger are damage to the intestinal mucosa, sepsis, and malnutrition. Persistent diarrhea lasts for 14 days or longer, and the main danger is malnutrition and serious non-intestinal infections. While diarrhea with severe malnutrition, the main damage are severe systemic infections, dehydration, heart failure, vitamin and mineral deficiency. There are different etiologies of acute gastroenteritis, the most common of which is rotavirus, presenting with vomiting initially, followed by watery diarrhea, low-grade fever, and with temporary lactose intolerance. Shigellosis usually presents with abdominal cramps, fever, diarrhea, and stools might contain blood and mucus. Cholera presents with profuse watery diarrhea and vomiting, which can lead to severe dehydration and death within hours. Salmonella AGE causes diarrhea, fever, abdominal cramps, as well as vomiting. Protozoan diarrhea can cause acute or persistent diarrhea, specifically in Giardia. Sometimes malabsorption, weight loss, with fatty stools, abdominal pain, and bloating. The most common of the protozoan AGE is Entamoeba histolytica. 90% are usually asymptomatic. It can range from persistent mild diarrhea to fulminant dysentery to liver abscess with tenesmus. The major risk factors for acute gastroenteritis are environmental contaminations and increased exposure to the enteropathogens. In the assessment of the child with diarrhea, history is very important. Note for the presence of blood in stools, the duration of diarrhea, the number of watery stools per day, the number of episodes of vomiting, and if there is presence of fever, cough, or other important problems like convulsions or recent measles infection. To support the history, a good physical examination should be done. These are some of the parameters. In minimal or no dehydration, or less than 3% loss of body weight during an acute gastroenteritis, the child is well and alert, drinks normally, with normal heart rate, pulses, breathing, and eyes. For mild to moderate dehydration, which is 3 to 9% loss of body weight, the child can be normal, fatigued, or restless, or sometimes irritable. The child is thirsty and eager to drink. The heart rate is normal to increased, as well as pulses, breathing, and the eyes are slightly sunken. For severe dehydration, which is more than 9% of loss of body weight, the child can be lethargic or unconscious, drinks poorly or unable to drink, with tachycardia or worse, bradycardia. There is weak or thready pulses, with deep breathing and deeply sunken eyeballs. Other parameters are as follows. You can review this table to assess the dehydration status of a child. According to the World Health Organization, in the assessment of child with diarrhea, look for condition of the child, the eyes, thirst, feel the skin pinch, then decide on what degree of dehydration and follow the treatment plans. For category A, the child is well and alert with normal eyes and drinks normally. The skin pinch goes back quickly. The patient has no signs of dehydration. Use treatment plan A. For category B, the child can be restless and irritable with sunken eyeballs, but the child is thirsty and drinks eagerly. The skin pinch goes back slowly. If the patient has two or more signs in this category, decide that the patient has some dehydration. Weigh the patient, if possible, and use treatment plan B. For category C, the child is lethargic and unconscious, with sunken eyeballs and drinks poorly or unable to drink. The skin pinch goes back very slowly. If the patient has two or more signs in this category, decide that the patient has severe dehydration. Weigh the patient and use treatment plan C urgently. The objectives of treatment is to prevent dehydration or treat dehydration. You should prevent nutritional damage and reduce the duration and severity of diarrhea and the occurrence of future episodes by giving supplemental zinc. Now let us go to the specific treatment plans. For treatment plan A, the home therapy to prevent dehydration and malnutrition, the first rule is to give the child more fluids than usual to prevent dehydration. Here are the suitable fluids to give to the child. While these are the unsuitable fluids. Give the child more fluids than usual to prevent dehydration. How much fluids do we give? As in general rule, for children less than 2 years old, give 50 to 100 ml or 1/4 to half large cup per drink. For 2 to 10 years old, give 100 to 200 ml of fluids, and for older children, give as much fluid as they want. The second rule is to give supplemental zinc. Give 10 to 20 milligrams every day for 10 to 14 days. Zinc is given for replacement of zinc that was lost during diarrhea. Give it immediately, and it lessens the risk of having new episodes of diarrhea in the following 2 to 3 months. Continue to feed the child to prevent malnutrition. Continue breastfeeding, but if not breastfeeding, continue with the usual milk formula that is being given to the child. Give other foods that are usually given to that child. Rule number 4. Take the child to a health worker if there are signs of dehydration or other problems. That starts to pass many watery stools, has repeated vomiting, is eating or drinking poorly, develops a fever, has blood in the stools, and the child does not get better in 3 days. For treatment plan B, oral rehydration therapy for children with some dehydration, give the reduced osmolarity of the ORS, which is composed of the following. The reduced osmolarity has a 245 millimoles per liter or milliosmoles per liter. How much ORS solution is needed? Here are the guidelines for treating children and adults with some dehydration. These are the approximate amount of ORS to be given in the first 4 hours, as determined by the weight. For children less than 4 months, give 200 to 400 ml of ORS. And as follows. In general, if the child's weight is determined, multiply it by 75 ml, and that is the amount to be given in 4 hours. Give zinc as well, and give the usual food that is being given to the child. For treatment plan C, or for patients with severe dehydration, here is the guideline for intravenous treatment of children and adults with severe dehydration. First, give 30 ml per kilogram in 1 hour and 30 minutes in older children. Then give 70 ml per kilogram in the next 5 hours for infants under 12 months of age and within 2.5 hours for older children. Use of Ringer's lactate solution is recommended. If LR is not available, normal saline may be used. Monitor progress of IV rehydration within 15 to 30 minutes until a strong radial pulse is present, or at least every hour to confirm that hydration is improving. If intravenous therapy is not available, a nasogastric tube at a rate of 20 ml per kilogram per hour for 6 hours can be done. Here's the management of acute blooded diarrhea or dysentery. Study the algorithm independently. Here's the table for diagnostics and treatment. For rotavirus etiology of AGE, the treatment is supportive care, fluid electrolyte replacement. For Shigella, you can give ciprofloxacin depending on the age, ampicillin, ceftriaxone, azithromycin, or chlortriamoxazole. For cholera, it is treated with tetracycline and erythromycin. Metronidazole is used for treatment of Entamoeba histolytica cause of acute gastroenteritis. For persistent diarrhea, in the management of persistent diarrhea, or diarrhea that begins acutely and lasts at least 14 days, admit patient with systemic infection, dehydration, and infants below 4 months. Treat dehydration. Identify and treat specific infections and give a nutritious diet. Supplement vitamins and minerals because minerals like folate, zinc, vitamin A, copper, and magnesium are lost during persistent diarrhea, and monitor response to treatment. Now you are ready to diagnose and treat patients with acute gastroenteritis in the pediatric clinics and wards. Thank you.